There are things that happen to your body that you did not plan for. The pulled muscle during a Saturday morning run that turns out to be a herniated disc. The 6 weeks of pain that follow. The referral to the sports medicine clinic. The Tuesday morning appointment that you have been dreading because you have been a person who prides himself on being fine and asking for help with your body is not something you have historically been good at. And then there is the thing that happens to everything else when you walk into a clinic and the doctor who comes into the examination room is not what you expected. Not in appearance exactly, in quality. The specific quality of someone who is completely present in the room with you. I had not expected that. I had not expected any of what followed. My name is Raphael Domings. I was 31 years old. I was a high school history teacher in Portland, Oregon. And the sports medicine doctor whose clinic I walked into on a Tuesday in February with a herniated disc at L4-L5 was named Dr. James Ockhafer. He was 35 years old. He changed my diagnosis. I do not mean the medical one. I mean the diagnosis I had made about my own life, about what it contained and what it was capable of containing. This is that story. The injury was my own fault in the specific way that most running injuries are. I had ignored the warning signs for 3 weeks because ignoring warning signs was a skill I had developed over 31 years of being someone who pushed through things. The warning sign had been a dull ache in the lower back on the right side that appeared at mile 4 of my Saturday runs and that I had attributed to tight hip flexors and had stretched at improperly, and had then made worse by continuing to run on it for 3 more weeks. When it stopped being a dull ache and became the specific sharp referring pain down the right leg that had woken me at 2 in the morning on a Thursday, I had finally called my GP. My GP was a thoughtful woman named Dr. Chen who had been my doctor for 6 years and who had the specific long-suffering expression of someone who regularly saw patients who had waited too long to come in. She had done the preliminary assessment. She had ordered an MRI. She had looked at the results with the expression of someone confirming what they expected. She said, "Herniated disc, L4-L5, you need to see sports medicine. I am going to refer you to Ockhafer at the Portland Sports Medicine Clinic. He is the best for this." I said, "How long will this take?" She said, "That depends on how well you follow the treatment protocol." I said, "That is not an answer." She said, "It is the only honest answer. Do not run for at least 6 weeks. Do not do anything stupid." I said, "I am a history teacher. I sit at a desk." She said, "And I assume you also go home and run on weekends. Do not do that." She was not wrong. The Portland Sports Medicine Clinic was in the Pearl District. A modern building that had the specific clean aesthetic of medical design done by people who had thought about how space affected the patient experience. Light wood surfaces. Actual plants rather than fake ones. The waiting area chairs designed by someone who understood that a sports medicine patient with an injury was probably not comfortable sitting in a standard waiting room chair. I had arrived 10 minutes early. I had a folder with my MRI scans. I had a list of questions that I had written at 10 p.m. the previous evening while the pain was significant enough that sleep was not happening. The intake nurse had taken my information with the specific efficiency of a good medical office and had said Dr. Ockhafer would be with me shortly. Shortly was 12 minutes. I was counting because counting was something I did when I was anxious, and I was anxious because I had not been to a specialist before, and because the pain was a constant reminder that something in my body was not working correctly, and I am not someone who is comfortable with things not working correctly. The examination room door opened. He came in reading my chart. I processed him in the rapid, involuntary way that people process things that are immediately significant. Tall, dark skin, his family from Nigeria on his father's side, as I would learn later. He wore the clinic's dark blue scrubs with the relaxed ease of someone who had been wearing them for years and had stopped noticing them. He had a quality of physical ease that made sense for someone whose entire professional life was about how bodies moved. He looked up from the chart. He looked at me. He said, "Mr. Domings, I'm Dr. Ockhafer. I've reviewed your MRI and your GP's notes. How is the pain today?" Not how are you, how is the pain today? The specific precision of someone who understood that his question needed to be about the thing he could help with. I said a 6. He said, "On the standard scale." I said, "Yes, down from an 8 this morning." He said, any changes in bladder or bowel function? I said no. He said, numbness or tingling below the knee? I said tingling, not numbness, the outside of my right foot. He noted this on the chart without looking away from me, which was a coordination I noticed because it was unusual. He said, I'm going to do a physical assessment. I need to look at your range of motion and nerve function. Is that okay? I said yes. He said, I'm going to ask you to move into some positions that might be uncomfortable. Tell me when something increases the pain. The goal is to find the direction that relieves it. I said okay. He said, let's start standing. Can you do a forward fold for me? Reach toward your toes, let your spine decompress. I stood, I folded, the right side complained. I said, that increases it. He noted this. He said, come back up slowly, now backward extension, hands on hips, gentle arch. This was better. He said, and that? I said, better, much better. He noted this. He said, that is very useful information. I want to check your reflexes and then I'm going to ask you to get into a quadruped position on all fours so I can assess your spinal movement patterns. Is that okay? I said yes. He helped me onto the examination table. He checked the reflexes, the patella tendon, the Achilles. He ran a blunt instrument along the sole of my foot checking nerve response. He said, quadruped when you're ready. I know it's not comfortable, take your time. I got onto all fours on the examination table. He assessed my spinal movement through the quadruped position with the same focused clinical attention he had brought to everything else, watching how my spine moved, watching whether the movement increased or decreased my symptoms, occasionally placing a hand on my lower back to feel the movement of the vertebrae. His hands were completely professional. They were also, and I am aware that this says something about my state of mind at this point, the most careful hands I had experienced in a long time. Not in the medical sense only. In the general sense of hands belonging to someone who was paying complete attention to what they were doing. I noted this and filed it immediately under. You have a herniated disc and a significant amount of pain medication in your system, and you are not a reliable narrator of your own perceptions right now. He helped me back to sitting. He said, based on the MRI and what I'm seeing in your movement patterns, this is a posterolateral herniation that is responding well to extension loading. The good news is that this pattern tends to respond very well to conservative management. We're not looking at surgery. I said, that is the good news. He said, the treatment is going to involve specific directional exercises, a phase of activity modification, and some manual therapy. I want to see you twice a week for the first 3 weeks and then reassess. I said, twice a week. He said, yes, I know that is a commitment. I said, I have 31 students who need their teacher present. He said, we'll schedule around your teaching hours. The exercises I'm going to give you can be done at home. The clinic visits are for the manual therapy and to track your progress. He said it all with the specific matter-of-fact quality of someone who was giving information rather than performing it. I said, Dr. Akefer. He said, yes. I said, how long? He said, conservative estimate, full return to running by 12 weeks if you do the program correctly. I said, and if I do not do it correctly? He said, then longer. I said, I will do it correctly. He said something I had not expected. He said, I believe you. 2 words, said with the specific quality of someone who had assessed the person in front of them and had arrived at a conclusion. I held the examination table. I said, how do you know? He said, the list of questions you brought. The fact that you called it a 6 when a lot of people would have called it a 9. The way you corrected me when I said tingling below the knee, you specified outside of the right foot. You are a precise person. Precise people do the program correctly. I held the table. I said, that is an unusual way to make a clinical assessment. He said, I find it useful. He handed me a printed sheet with the first set of exercises. He said, any questions? I looked at my list. I asked 4 of the 7 questions. He answered each with the same focused precision. He said, you can ask the other 3 at Thursday's appointment. He had noticed how many questions were on the list. He left the room. I sat on the examination table for a moment. I thought herniated disc L4-L5 extension loading protocol twice a week. I thought he noticed how many questions were on the list. I put my coat on. I went to the front desk. I scheduled Thursday. Thursday came. The exercises had been doing something. The referring pain down my leg was quieter, though not gone. I had done the extension protocol exactly as instructed, 3 times per day. The specific discipline of someone who does not do things halfway applied to the lying face down and propping myself up on my elbows while watching the pain centralize. I had also been thinking more than was medically necessary about a sports medicine doctor named James Ockhaffer. Not in the romantic sense exactly. In the more specific and harder to name sense of someone who has encountered a quality of presence they do not usually encounter and who cannot stop turning that encounter over in their mind. His absolute focus. The way he said, "I believe you," the noticing of the question list. I had told myself this was simply the response of a patient who had been received with unusual care by an excellent clinician, and that mistaking the quality of excellent clinical care for something personal was both common and a mistake that I was not going to make. And then I went to Thursday's appointment, and he remembered my name without looking at the chart. And he asked how the centralization was progressing, and when I described it, he said exactly what I was hoping he would say, which was good, that means we are in the right direction. And then he asked about the 3 remaining questions from my list. And I thought, this is a problem. Twice a week for 3 weeks became twice a week for 5 weeks because the progress was good, but the manual therapy was producing results that warranted continuation, and I was not going to argue with results. 10 appointments. In 10 appointments, I learned the following things about Dr. James Ockhaffer. He had done his medical degree at the University of Michigan and his residency at OHSU. He had been at the Portland Sports Medicine Clinic for 3 years. He had played competitive basketball in college, not at the level of anyone thinking about a professional future, but seriously enough that the sport had shaped how he thought about athletic movement. This was relevant because it was why he understood what it meant to a runner to not be able to run, which was a specific and significant loss that not all doctors appreciated. He had a younger sister who was an architect in Houston, and whose opinions about his apartment decor he had been ignoring for the past 2 years of her requests to be allowed to help. He had a friend group that he described as primarily from his residency years who were scattered across the Pacific Northwest, and who he saw on a rotating schedule that was organized with the same precision he brought to his clinic. He had an opinion about Portland coffee that was more specific than the average Portland resident's opinion about Portland coffee, and that he expressed, when the subject came up, with the particular conviction of someone who had done actual research. I learned these things in the specific way you learn things about a person whose professional role requires you to be in a room with them twice a week for over a month. Through the particular combination of professional exchange and ordinary human conversation that fills the space between the clinical and the personal when 2 people are compatible in the specific sense of finding each other's minds interesting. I should note, the professional role was always the primary context. He was always Dr. Ockhaffer. He was always focused on the clinical purpose of the appointment. The conversations about architecture and basketball and Portland coffee happened in the margins, in the 10 minutes before and after the treatment, in the natural pauses that occur when a person is performing manual therapy on another person's lumbar spine. But they happened. And in the specific architecture of my inner life, they were building something. I had not been in a relationship for 2 years. Not because I had not wanted to be. Because the year before the injury had been one of those years that happens to people who are 30 and have demanding jobs. The year in which the job and the friends and the maintenance of the ordinary life took all the available bandwidth, and the remaining bandwidth was not sufficient to add another person. I had been out since I was 22, comfortably, completely. My family, my parents from Oaxaca, my 2 younger brothers, my grandmother who visited every Christmas and who had received my coming out with the specific practicality of a woman who had survived harder things they knew. My friends knew. My students, in the general sense of a teacher who did not hide his identity, knew. I was not managing anything except the back injury. And the thing that was building in my inner life as a result of 10 appointments with James Ockhaffer. At the 8th appointment he said, "Your centralization is complete. The nerve symptoms in your foot are resolved. We're moving into the maintenance phase." I said, "That sounds like progress." He said, "It is significant progress. You did the program correctly." I said, "You said you believed I would." He said I was right. I said, "How often is your clinical intuition correct?" He said, more often than my basketball free throw percentage, less often than I would like. I said, what is your free throw percentage? He said, embarrassingly low for someone who played college ball, which is why I am a sports medicine physician and not a professional basketball player. I said, the career pivot worked out. He said, in most ways, yes. He said it with the specific quality of someone who has left a door slightly open. I said, most ways. He said, I enjoy the work very much. I said, but. He said, the maintenance phase, what is your plan? He had redirected. Not defensively, practically, the professional redirect of someone who has identified a boundary and has chosen to honor it. I noted this. I said, the home exercises, return to running at week 12. He said, I want you back at week 12 for a functional assessment before you return to running, then one final appointment at week 16 to close out. I said, 2 more appointments. He said, yes. The room felt different at week 8 than it had at week 1. I was not sure exactly what the feeling was. It was the specific quality of something that had developed between 2 people in the context of a professional relationship, and that both of them were aware of and neither of them was doing anything about because the professional relationship was still the operative context. I said, Dr. Aukefer. He said, yes. I said, thank you for the last 8 weeks, the treatment has been, I stopped. He said, yes. I said, more than clinical. He held his clipboard. He said, I'm glad you feel that way. He said it carefully, the specific care of someone who understood exactly what was being communicated and was also very clearly aware of the professional context in which it was being communicated. I said, I mean that you explain things well, you made me understand what was happening to my body. He held the clipboard. He said, I understood what you meant. The room was very quiet for a moment. He said, week 12, don't run until then. I said, I won't. He said, I know. I ran on Monday and Wednesday mornings of weeks 10 and 11. Gently, carefully, with the specific discipline of someone who had been told the protocol and who had also been a person who ran for 10 years before the injury and who understood that the body was ready even if the calendar said week 11. I did not tell Dr. Aukefer this at the week 12 appointment. I told him about the functional tests, the single leg squat, the hip hinge, the lateral band walk, all of which felt strong. He assessed each one. He said, your movement quality is excellent, hip stability has improved significantly since week 1. The gluteal inhibition we saw in the early assessments has resolved. I said, that sounds positive. He said, I'm clearing you for return to running, start with 20 minutes, see how the lower back responds. I said 20 minutes. He said, yes, not 40, not an hour, 20, then we increase from there. I said, Dr. Aukefer. He said, yes. I said, I ran on Monday. He was quiet. He said, how was it? I said, 22 minutes, no pain, some awareness but not pain. He was quiet for another moment. He said, how was the centralization during? I said, maintained. He said, any referring symptoms? I said, no. He said, you knew it was ready. I said, yes. He said, you should have told me. I said, yes. He said, why didn't you? I held the examination table. I said, because I did not want you to tell me to stop. He said, I would not have told you to stop if the response was what you described. I said, I know that now. He held the clipboard. He said, Raphael. My given name, not Mr. Domings. I said, yes. He said, you are a precise person who follows protocols, why did you run early? I held the table. The examination room at week 12. I said, because I wanted something to be resolved before the last appointment. He held the clipboard. He said, and is it resolved? I said, the running question is resolved. He held the clipboard. He said, week 16, one final appointment. I said, yes. He said, we will close out the clinical picture at week 16. I said, and the other picture? He held the clipboard. He held it for a long moment. He said, the clinical relationship has specific boundaries that exist for important reasons. Those reasons remain operative until the clinical relationship is concluded. I said, that is a very precise sentence. He said I am a precise person. He said it with the specific quality of someone returning a word that had been used to describe them. I said week 16. He said week 16. I did not wait until week 16. I waited until week 15, day 4. I emailed the clinic. Not Dr. Okafor directly, the clinic's general inquiry email. I said, I am a current patient of Dr. Okafor and I have a non-clinical question. I understand if it is not appropriate to respond to this through this channel. I simply wanted to ask whether there is a professional protocol for when a patient wishes to reach out to a physician on a non-clinical basis after the conclusion of care. I was aware, the most carefully constructed email I had sent since a job application for the position I currently held. The response came in 3 hours. It was from the clinic's general email. It said, the clinic does not have a formal policy on this matter as it is quite rare. Any communication on a non-clinical basis would be the personal choice of the physician and would occur outside the clinic's professional channels. The clinical relationship concludes at the final appointment. 3 hours later, I received an email from a personal address. The email said, hello, this is James Okafor. My clinic received an interesting inquiry and I wanted to respond personally. I should say that I am not in the habit of corresponding with patients outside clinical channels. I should also say that I was hoping you would find a way to ask this question. I would very much like to have coffee with you after the week 16 appointment if that is something you would like. I held my phone. I read the email 3 times. I responded, yes, I would like that very much. The week 16 appointment was the most professionally focused appointment of the 16 weeks. Whatever had been communicated in the email exchange existed in a completely separate compartment from the hour I spent in the clinic. He was Dr. Okafor, I was Mr. Domings. He assessed my running gait. He reviewed the progressive return to training. He tested the functional movement patterns. He was thorough and precise and completely clinical. He said, I'm very pleased with where you are. The herniation is centralized and the movement quality is excellent. You have a strong foundation for a return to your full training volume. He said, is there anything remaining that is concerning you clinically? I said no. He said, then I'm going to close out your case. He said this with the specific quality of someone saying something that has more than one meaning. I said, I understand. He typed something on the chart. He said, you are discharged from care as of today. I said, thank you for everything. He said, thank you for following the protocol. He said it with the specific tone of someone who was aware that the protocol in question covered more than the back exercises. He stood, he held out his hand, I shook it. He said, I'll see you outside. I said, yes. He went to complete the discharge paperwork. I put my coat on, I picked up my bag. I thought, in 10 minutes I am going to be standing outside a sports medicine clinic having coffee with a man named James Okafor who remembered my name without looking at my chart and noticed how many questions were on my list, and said I believe you as if it were a specific and considered statement rather than a routine reassurance. And I thought, the disc is healed. And I thought, the other thing is just beginning. He came out of the clinic 11 minutes after I had. He had changed from the dark blue scrubs into a dark green sweater and dark trousers. Without the scrubs he looked different, the same quality of presence, the same physicality, but different in the specific way that a person looks when you see them in a new context for the first time. He said, I know a place 3 blocks from here. I said, lead the way. We walked 3 blocks. The coffee shop was exactly right, not too loud, not too quiet. The specific afternoon quality of a Portland cafe on a Thursday at 3 p.m. when the post-lunch rush has cleared and the before-dinner crowd has not yet arrived. We sat at a table near the window. He ordered black coffee. I ordered something with milk that I immediately wondered if I should have matched his black coffee because matching might have communicated a specific kind of attentiveness, but then decided that ordering what I actually wanted communicated a different kind of attentiveness, and that the latter was probably more honest. He said, I want to say something before we talk about anything else. I said, say it. He said, I have never done this before, had coffee with a former patient, and I want to be clear that I was fully aware of the boundary throughout the clinical relationship and I did not behave inappropriately at any point. I said, I know. He said, I want to say it explicitly. I said, I know that too, and I want to say explicitly that I was also aware of the boundary. Every conversation we had was appropriate. You never behaved in any way that was not entirely professional. He held his coffee. He said, thank you for that. I said, it is true. He said, the email. I said, yes. He said, that was very creative. I said, I am a history teacher. I am good at research protocols. He said, you researched the protocol for contacting a physician non-clinically. I said, I was aware there might not be a formal policy. I was hoping the query would be passed on. He said it was. I said, I know. He said, by the receptionist who thought it was the most amusing thing she had received in her professional career. I said, I am glad my discomfort provided amusement. He said, you were not very discomforted, the email was very direct. I said, I am a precise person. He said, yes, you are. He held his coffee. He said, Raphael. I said, yes. He said, I want to say the thing that would have been inappropriate to say at any point in the last 16 weeks. I said, say it. He said, I have been looking forward to week 16 since week 3. I held my coffee. I said, week 3. He said, the appointment where you brought a research paper on extension loading protocol and you had annotated it in 3 different colors of pen. I said, I wanted to understand the mechanism. He said, you had highlighted my name in the acknowledgement section. I said it was thorough. He said, you had highlighted my name in the acknowledgements section of a paper I co-authored 3 years ago and you had written a small question mark in the margin next to the method section. I said the method section had a gap. He said yes it did, it was a legitimate methodological concern. He said, and also the most extraordinary thing any patient has ever brought to an appointment. I held my coffee. I said, James. Not Dr. Akefer. He looked up. I said, I have been thinking about you in a non-clinical way since week 1. He said, week 1. I said, when you said I believe you. He said, that was the standard clinical. I said, it was not standard, it was specific. You assessed me and you arrived at a conclusion and you said I believe you because you meant it precisely. He held his coffee. He said, yes, I did. I said, I have been in my own way a precise person about this. I knew the boundary, I honored the boundary, and I also thought about you more than was medically indicated. He said, yes. I said, and then I sent a research protocol email to a clinic. He said, yes. I said, and here we are. He held his coffee. He held it for a moment. He said, here we are. He said, I should tell you something. I said, tell me. He said, I am gay. He said it with the specific directness that I was coming to understand was his characteristic quality, not I think not this might be relevant but the direct statement of a true thing. I said, I know. He said, how? I said, the architecture conversation. You described your sister's approach to your apartment and when you talked about the space you were imagining, I had the sense you were describing something that was yours without reference to what anyone else would expect it to look like. He held his coffee. He said, that is a very literary way to have arrived at that conclusion. I said, I teach literature too. He said, I thought you were a history teacher. I said, history and literature, the two are not separate disciplines. He said, no, they are not. He said, and you? I said, also gay, since I was 22, out since then. He said, your family? I said, my grandmother takes the longest. She is from Oaxaca and she was 73 when I came out and the framework required adjustment. She adjusted. He said, how? I said, she made mole for me specifically. Her mole takes 3 days. It is her language for I am working on loving you better. He held his coffee. He said, that is extraordinary. I said, she is extraordinary. He said, Raphael. I said, yes. He said, would you like to have dinner with me? I said, after the coffee. He said, yes, tonight. There is a restaurant I like in the Pearl District. I said, the coffee shop is in the Pearl District. He said, yes. I said, you plan this. He said, I know a restaurant 3 blocks in the other direction from the clinic. I said, you researched. He said, I am a precise person. I held my coffee. I said, James Akefer. He said, yes. I said, yes, I would like to have dinner with you. The restaurant was exactly right. Not fancy in the performed way, good food made carefully. The specific Portland restaurant of a certain kind, the kind where someone had thought seriously about what they were doing and had done it with full attention. We ate for 2 hours. We talked about everything we had not talked about in the clinical context. His family, his father who had come from Lagos as a medical student, and who had built a practice and a family in Michigan with the specific determination of someone who understood that the opportunity required honoring. His mother who taught secondary school science, and who was, by James's account, the most organized person he had ever known. The sister in Houston whose architectural opinions about his apartment he had now decided to partially accept. My family, my parents from Oaxaca who had come to Portland before I was born and who ran a restaurant in the Alberta Arts District. My brothers who were both more practical than me and who communicated this regularly. My grandmother who made the 3-day mole. He said, "Your grandmother's mole, you described it as her language for working on loving you better." I said, "Yes." He said, "What is your language for that?" I held my wine. I said, "Research." He looked at me. I said, "When something matters to me, when I want to understand something, when I want to be prepared for something I care about, I read everything available, I annotate it in 3 colors of pen." He held his wine. He said, "You annotated the paper." I said, "Yes." He said, "The paper I co-authored." I said, "Yes." He said, "In 3 colors." I said, "Red for methodology concerns, blue for interesting findings, green for questions to ask at the next appointment." He said, "You brought a paper to your second appointment to a sports medicine clinic." I said, "I wanted to understand what was happening to my body." He said, "That was also your language." I said, "Yes." He held his wine. He said, "I need to tell you something." I said, "Tell me." He said, "The acknowledgments section of the paper, where you highlighted my name and wrote a question mark in the methods section." I said, "Yes." He said, "I photocopied that page." I held my wine. I said, "You photocopied it?" He said, "Yes." I said, "The page where I had written a question mark next to your name." He said, "The methodological concern was legitimate." I said, "James." He said, "Yes." I said, "That is the most." He said, "Appropriate clinical documentation I have ever maintained." I said, "That is what you're calling it." He said, "Yes." He was not smiling exactly, but the specific quality of someone managing not to smile was visible. I said, "James Okafor." He said, "Raphael Domings." I said, "I would very much like to see you again." He said, "I have your email from the clinic inquiry system." I said, "You have my email from the inquiry system." He said, "For non-clinical purposes." I said, "For non-clinical purposes." He said, "I will use it." I said, "Yes, please." The herniated disc was healed. I was running 40 minutes on Tuesdays, Thursdays, and Saturdays with the specific disciplined joy of someone who had been told they could not run and had been given it back. I was also, in the months since the coffee and the dinner and the email he had sent the following day, doing something I had not done in 2 years. Being in something. Not carefully, not with one hand on the door, completely. James was the most precise person I had met, and the most present person I had met. And the combination of those 2 things in a person who also photocopied the page of a paper where a patient had written a question mark next to his name in the acknowledgments section was a combination that I had not planned for and that I was not going to be careful about. We had dinner on Saturday evenings. We had coffee on Wednesday mornings before his clinic started and before my first period class. We had learned each other's rhythms the way people learn rhythms when they are paying attention, not by making rules but by watching what worked and doing more of it. His apartment was in the Pearl District. The sister in Houston had been partially consulted. The east-facing wall of the living room now had a print that was both architecturally sound by his sister's assessment and personally meaningful by his. It was an anatomical diagram of the human spine, specifically the lumbar region, framed in pale oak. I had looked at it the first time I came to the apartment. I had said, "That is an unusual decorating choice." He had said, "My sister thought so too." I had said, "It is also specific." He had said, "Yes, the print became available in February." I said, "February." He said, "February is when I started thinking about things differently." I said, "James." He said, "Yes." I said, "That is the most precisely decorated expression of a feeling I have encountered." He said, "I told you I was precise." My grandmother came to Portland in April. She had been visiting every April for as long as I could remember. She stayed for 2 weeks, she cooked. On the second Saturday of her visit, James came to my parents' restaurant in the Alberta Arts District for dinner. My mother, who communicated warmth through the specific volume of food she offered, provided 4 courses. My father, who communicated approval through the particular questions he asked James about his family's history in Michigan, and about the medical practice he was building with the specific interested attention of one first-generation immigrant recognizing the quality of another first-generation immigrant story. My brothers were their practical selves and provided the specific calibration that brothers provide. And my grandmother. My grandmother sat beside James at the table and she asked him 3 questions about his work, and she listened to the answers with the focused attention of a 79-year-old woman who had been listening to people for a long time and who knew the difference between a person talking and a person meaning what they said. After dinner, she found me in the kitchen. She said in Spanish, "He is very careful." I said, "Yes, he is." She said, "The careful ones are the ones who mean it." I said, "Yes." She said, "Your mole will be ready on Tuesday." I looked at her. She said, "I started it this morning." I said, "Abuela." She said, "Go back to your friends." She went back to the table. I stood in the kitchen for a moment. 3 days of mole. Her language for working on loving something better. She had started it the morning she met him. I went back to the table. I sat beside James. He looked at me. He said quietly, "Your grandmother." I said, "Yes." He said, "She is extraordinary." I said, "I told you." He said, "She told me something." I said, "What did she tell you?" He said, "She said, precise people make good doctors and also good partners." She said it in Spanish. I understood about half of it. I said, "Which half?" He said, "The important half." I held my wine. I said, "James Okafor." He said, "Rafael Domings." I said, "I love you." I said it the way I said things that were true, without ceremony, without performance. The direct version, at a table in my family's restaurant in Portland in the spring. He held his wine. He held it for the specific moment of a person who has been precise about things for 35 years and has arrived at a point where precision is not the right response and something else is. He said, "I love you too." He said, "I have been annotating that fact in 3 colors since February." I said, "Show me." He said, "Yes." He said, "Tonight." He said, "I photocopied the page." I said, "Of course you did." He said, "It is an important document." I said, "Yes." He said, "It has a question mark next to your name." I said, "The question has been answered." He said, "Yes, it has." My grandmother from across the table, watching us with the specific expression of a 79-year-old woman who has seen everything twice and who is pleased with this particular thing. She said something in Zapotec. My father looked at her. He said, "What did she say?" My mother said, "She said the mole will be perfect this year." My grandmother held her wine. She almost smiled. I held James's hand on the table. The spring. The restaurant. The family around us. The disc healed. The back pain gone. The precision applied finally to the right things. Everything exactly where it was supposed to be.